Men and osteoporosis risk statistics tell us that 20% of persons with osteoporosis are men. This translates to about 2 million American men are suffering from the disease. Osteoporosis is the thinning of the bone so that the bones become weak and are likely to suffer from fractures. 12 million men are believed to be at risk for osteoporosis because they have osteopenia, which is low bone density that doesn't yet meet the criteria of osteoporosis. According to the International Osteoporosis Foundation, this disease is responsible for more than 8.9 million fractures every year across the globe, which equates to an osteoporotic fracture every 3 seconds. 20 to 25% of all hip fractures occur in men, with the mortality rate at about 20% in the first 12 months following the fracture, a rate that is higher in men than in women. Why are men at a lower risk of getting osteoporosis? Part of the issue is that women live longer than men live and so are more likely to get osteoporosis. Men also tend to be more physically active, which is protective against osteoporosis. While in women, menopause triggers osteoporosis, while in men it is believed to be due to low testosterone levels. Men who have osteoporosis should always be tested for low testosterone syndrome. For these men, they need to have their testosterone levels checked. Men who have osteoporosis, osteopenia, and testosterone deficiency usually need some kind of testosterone replacement that will build bone mass. Men also need a bit of estrogen, which comes from conversion of testosterone to estrogen. Estrogen helps save bone density in both men and women. It is believed that all of the testosterone given to men for osteoporosis is eventually converted to estrogen, which builds bone mass. Men who lack the enzyme necessary to make estrogen from testosterone will get osteoporosis and, by giving these men estrogen, the osteoporosis gets better, even if it is a very small amount of estrogen. Causes of osteoporosis: in order to make new bone, men need to take in enough calcium and vitamin D in their bodies. Calcium and vitamin D help provide the substrate that makes up bone and are necessary to build bone. Another cause of osteoporosis in men is a lack of exercise. Men tend not to exercise in the way they should. Statistics show that, among men aged 25 to 64, only 30% meet the minimum amount of exercise necessary according to the Surgeon General's office. This means exercising about 30 minutes per day on most days per week. Exercise is known to increase bone mass and that the exercise needs to be things like jogging or walking, rather than lifting weights. Certain medications will not build bone mass. These include being on corticosteroids that treat a number of male diseases, such as autoimmune diseases and asthma. Drugs for prostate cancer, such as GnRH agonists, will decrease bone mass and increase the risk of fractures. Medications used for seizures can lower bone mass, especially in situations where vitamin D and calcium are not taken. Certain medical conditions can cause low bone mass. These include diseases like cystic fibrosis, rheumatoid arthritis, blood disorders, digestive problems, and diabetes. Men who have a chronic condition should do all they can to increase their diet and exercise to maximize the density of bones. Smoking can contribute to bone loss. Statistics tell us that men who smoke have a 55% greater risk of hip fractures when compared to men who do not smoke. Bone density is lower in men who smoke. This is believed to be due to the effects of nicotine on the bone density. Helping male menopause: there are things that can be done to improve bone mass and reverse the effects of osteoporosis. These include the following: exercise. Make sure that you exercise throughout your life and build calcium and vitamin D during adolescence and early adulthood. The more you have these substances in your bones through exercise in the teen years, the less likely it is that you will lose bone mass later in life. You need to participate in weight-bearing exercises but avoid contact sports. Good sports to do are basketball, jogging, rope jumping, inline skating, and cross-country skiing. Try to stick to 30 minutes of activity on at least 4 days per week. Strength training should be done about twice a week. Take in calcium. This means getting enough calcium with vitamin D. The Surgeon General's report indicates that you should take in 1,000 mg of calcium per day if you are between the ages of 19 and 50. If you are over 50, you should take in 1,200 mg of calcium per day. Get vitamin D. Vitamin D is necessary to take in calcium. The recommended daily allowance of vitamin D is 400 IU, however, some doctors recommend more vitamin D if you already have osteoporosis. In such cases, 800–200 IU per day of vitamin D is recommended if you live in a cloudy environment. If you have a medical condition that can weaken the bones, talk to your doctor about which things you can do to prevent a fracture from occurring. For more informative videos and articles about health and fitness, please visit us at malehealthclinic.com.